Good afternoon, everyone. Good morning, everyone. Good evening, everyone. Wherever you are, whatever time it is, welcome to an episode of Driving with Dr. Kidney. And today we have our special guests. We have one of our social workers, Jill, that's sitting to my right. And in the back, we have two dietitians. You're going to hear things in stereo. We have dietitian Asa and our dietitian Isabella. So today, I'd like to focus on some of the social issues that many of our patients face, whether you're on dialysis, getting ready to go on dialysis, looking for a kidney transplant, etc. So we'll start off by doing this chronologically, that when prior to being on dialysis, you've been seeing us in the office for management of chronic kidney disease issues, and now you've outlived your kidney function. It's one of the sad things that we go along, that we entertain or encounter as we're living longer these days. Along with, we've put you on the transplant list or referred you for transplant, and we know that that takes a significant period of time. So what we'd like to do is now discuss some of those things that we face in the office. So Jill, before a patient is on dialysis, if there were some things that you were going to talk to them about or recommend to them, what would it be? What would it be in order to prepare for going on dialysis?
One of the first things that I think is important for patients to know about is just to keep as much normalcy in their life as possible. Like, dialysis doesn't have to be this, it doesn't have to define you. And so I would tell patients to keep up with things like seeing their family, traveling if they can, and continue to work if that's possible, or if you have to take a leave from work, but just make it temporary, because you're going to adjust and things are going to get better. And then you want to continue as much of your normal life as possible.
So not be afraid. Don't be afraid.
Yeah, don't be afraid
to continue doing what you were doing prior.
Yes.
That is, again, it's not limiting you. Dialysis is just another portion or treatment that you have to continue and go through. But it's not something that's going to say, look, this is the end of my life.
Right.
And for many of them, we want to use it as a bridge to transplantation. In fact, that's what dialysis was meant to be. It's just that the number of patients that are affected these days with chronic kidney trouble, and since we're living much longer than anticipated, we actually are faced with a situation where, thank goodness, dialysis is available, but we can still be pursuing that transplant.
Yes.
And so now we bring up the topic of transplants. Or any things that you want to maybe tell people before they're on dialysis, or even on dialysis, what it is about the transplant that you would want them to do?
The thing that I would want patients to know is, like, don't delay transplant. Because we have patients that start dialysis and they're overwhelmed, and it's hard to think about all the things that are being thrown at them, and transplant is one of them. But it's really important to start as soon as possible, because the patient has control over that transplant process. Even if we get started, the patient can stop the process at any time. They can say, I don't want to do this, but at least get it in motion. It takes a while to go through the process. The referral takes a little while. And I don't think patients realize how long it takes to actually go through evaluation and get listed. And so it's really important to get started right away. And then you can change your mind later if that's what you decide.
Right, so you want to try to burn up the time before you're on dialysis, burn up the time on the list, and that's what we try to encourage patients to get listed or pursue listing when their percentage function goes right below 20, and that's when 20% is the magic number where the transplant centers will start evaluating you.
Yes.
When we talk about the differences between dialysis and transplantation, one of the things that comes to my mind is the foods that they eat prior to a transplant or while they have a transplant versus on dialysis versus off dialysis. Sometimes those dietary restrictions can be very unnerving and very difficult to understand. So, Isabelle, what do you say to people that, where do you notice that there are certain things that are different with each one of those, or some of the things that come up a lot that you would want to convey to someone?
I think the most important thing is do not use Google to find information about your diet. It's extremely individual. I think the patients need to understand that, whether it's pre-dialysis, on dialysis, hemodialysis, home dialysis, everybody's different. So if you know somebody that's going through the same thing, and you're talking to somebody else in the lobby, just remember that your diet is yours, and any questions should be directed to the dietitian. And our job is really to make it as flexible as possible. We're not there to limit their quality of life that they like. We're there to compromise. We want them to eat out. We want them to have what they like. And it's, by educating them, they'll be able to do it. There's certain things, for example, like protein, that's, not negotiable. They're going to have to eat their protein. You just have to find the best source of protein. Same thing with phosphorus. Well, chances are phosphorus is going to have to get restricted, and they're going to have to take medication for it. Potassium is kind of on the line. Some patients do have to limit, some others don't. But really, my message is talk to your dietitian, because what you're going to have to do may not be what your neighbor has to do.
Very good. Yeah, very good. Asa, you have anything to add to that, or
I think the red thread through the whole thing here is the quality of life. We have to help our patients find their new quality of life, and that's going to be what we're aiming at. Don't feel like the dietitian is there to tell you what to do necessarily. We're there as a resource. We're only there to help. We're not the food police coming out telling you no, or telling you do or do not. We're finding your way forward and hopefully not changing too much.
right? And I like I really like what Isabelle said, that it has to be individualized. So there's and you mentioned looking up on the internet or googling what the diet should be. Yes, that might be a helpful guide, but it's not exact for everyone, and everybody's different, and that's why it has to be individualized. Dietary restrictions or dietary modifications need to be individualized for each of the patients. But I think one thing that that goes across all patients is really sodium intake, right? Right. I mean, we want patients to limit sodium intake, because that can have detrimental effects on all aspects of their life, and especially with high blood pressure, weight gains, and fluids, etc. So another topic that I wanted to discuss, or actually, Jill, if you can address, is patients. They, we live in a very unusual area, that we do see a lot of travelers, but we know that there are patients that live in one area, and they're deciding that whether or not they can travel. And what do you say to that patient? Are they going to be restricted, or what would you tell them, or your advice?
Yeah, for patients who want to travel, you can still travel, and that's one of the things that patients have a really hard time with. One of the things that I hear very regularly is I miss being able to travel. And so what I try to tell patients is that you can still travel. You may not be able to be as spontaneous as you once were. You can't just pick up on a Friday morning and say, hey, let's go for a week somewhere. It may not be as spontaneous as it once was, but you can still travel with some planning involved. And I help patients do that. I'm helping a patient right now schedule an international trip to Argentina. And so we have patients who have gone on dialysis cruises. So all those things are still possible. It just takes a little bit more planning and patience.
And similar, so it would be similar or along the lines of someone who's handicapped or disabled, that those things are still available. You just have to dig in a little bit.
Yes.
And that's what your role, or the social worker role, would be in the dialysis facility to help out.
Yes.
Okay.
Yes.
And one of the other another topic that if you can address now is, patients will ask me, hey doc, this looks expensive. When you start talking about dialysis or a transplant, they say, I don't have the money for this. How am I going to pay for this? And I know this is a very, very broad topic. But what would your advice be? I'm a working individual, and I have a job. I have insurance through my job, etc. Something like that. What would your advice be?
Yeah, and for those patients who are already working and they start dialysis and they have coverage through their employer, the best option for them is to keep that coverage, to keep working, keep that commercial coverage. It's probably a good policy through your employer. And so keep that. And we also have assistance programs that can help patients if they are struggling with their bills. We have a couple of different options for things like that. We have a program that helps cover the insurance premiums. We also have a program that will assist lower income patients if they meet those income qualifications, where we waive our bills from U.S. Renal Care. But the commercial coverage is really good. If you can keep it, keep it. And then there's also Medicare. A person who is on dialysis is eligible for Medicare regardless of their age. And we can also assist those patients with enrolling in Medicare and getting a supplement. It is overwhelming. It is scary to think about the cost of treatment, but there are options, and I'm here to support and help our patients through that.
That's excellent to know. It's more of a relief then. We provide them with the relief because it's bad enough that they have a disease process, and now all of a sudden they're concerned about, well, how am I going to pay for it? Well, it's good to know that if those insurances are available and the centers or the companies, the dialysis companies, are willing to help out and make those donations to places such as the National Kidney Foundation.
Yes, yes.
All right, so we discussed a lot of things here today, and I think we've covered a lot of information. Is there anything else that you might want to convey to any of the individuals that are out there that may not have been mentioned in these small discussions?
The only other thing that I would bring up is just mental health. That starting dialysis, any sort of, diagnosis of a chronic illness, there's a lot of changes involved and there's a lot of adjustment. And patients may feel down, they may feel depressed, they may feel anxious. And so it's just really important that you talk to me, or to your social worker at your clinic about those things. It's normal for you to feel that way. And it is an adjustment process, and things get better. But it gets better as you talk about it, because when we talk about it, we're processing it. So the more we process information, the more we understand it, and the better we feel.
Right.
So I would just encourage patients to let someone know, let your social worker know, let your doctor know if you're feeling depressed, if you're feeling down. There are ways that we can support you.
Yes, and one other things that I've noticed is that sometimes people will manifest their frustration in different ways. And just a reminder, we are all on the same team. The healthcare team that's here, whether it be social worker, dietitian, physician assistant, we are all here to help you. The technicians, the nurses, we are all here. We're all on the same team, and we're all here to help you get better and to make sure that you live a long, healthy life. And if we're using this as a bridge to transplantation, then so be it. And then we want to get you that transplant as soon as possible, provide you with the right information and knowledge, as well as resources to help you get that kidney. And if it's unfortunate that you cannot get a kidney transplant, you don't have a potential donor, and that dialysis is going to be for the remainder of your life, we want to make sure that it's going to be as comfortable for you as possible, that you deal with the situation, and knowing that, as Jill brought up, if there's anything that comes up, that we are here to help. And I like the fact that you bring up the mental health, because it goes back to the old adage, sound mind, sound body.
Mm-hmm.
You've got to have both in conjunction with one another, working together to allow for a happy and healthy life, healthy lifestyle. So,
yes.
Anything else? Anybody want to mention anything else? Isabelle, Asa?
Just in line with what Sean's talking about, we're here to help everybody. And we want for patients to verbalize how they feel about food and their frustration, and not try to hide things from us. If they really want something, or if they're just really discouraged about not being able to eat something, that we're definitely going to work with them and try to make things happen. But we have to have a discussion about it.
All right. Well, thank you everyone for joining us today. Another episode of Driving with Dr. Kidney. We look forward to providing more information to you all in the future. Thanks again. If there are any questions, please don't hesitate to ask any one of us, either alone or when we're rounding on with you in a group basis. Have a great day.